Welcome to South Africa, the Rainbow Nation. South Africa is a country of 59 million people from all walks of life. We are a melting pot of urban buzz and rural heritage. We are home to Nelson Mandela and Bareka Girls, beaches, and rugby. But we are also the epicenter of the world's HIV pandemic, with 7.8 million people living with HIV and 230,000 people newly infected with HIV in 2020. While the nation has the largest treatment program in the world and has made huge strides towards reducing the spread of HIV, the national picture masks inequalities. HIV vulnerability is exacerbated by behavioral, social, and structural factors and is most pronounced in key population groups who remain and are pushed to the fringes of healthcare and social services. This is a story about how South Africans are building solid relationships and holding each other accountable to do better in scaling up quality programs for key populations. This is a story of how the nation strives to ensure that key populations get tailored services, which are driven by peers and underlined by human rights.
For so many aching years, we have, of course, been worried and concerned about the key population in terms of accessing equitable, affirmative, and competent services. As a country and as well as civil society, our commitment has always to advocate and advance the needs as integrated in the National Strategic Plan. It is, of course, the very same principles of human rights and equality that nobody should be left behind in the strategy and in the implementation thereof. Our mandate as civil society is to continue to monitor, to coordinate, and ensure that we safeguard the rights as enshrined in the Constitution. And of course, addressing social and structural drivers realizes that every stakeholder is important and ensuring that every person, every citizen is reached, those who are in South Africa.
The National Strategic Plan for HIV, TB, and STIs guides the South African national HIV response and prioritizes 5 key population groups with estimated population sizes of 150,000 sex workers, 1.2 million men who have sex with men, 80,000 transgender people, 140,000 people in prisons, and 67,000 people who inject drugs. The implementation response to key populations is guided by population-specific plans, including the National Sex Worker HIV, TB, and STI Plan, the South African National LGBTI HIV Plan, and the National Drug Master Plan, all of which lay out the management and implementation arrangements required to ensure the scale-up and quality provision of a comprehensive package of services to achieve impact. We are now going to take you on a journey to some of the key population program sites in the country who provide a comprehensive package of services tailored to the unique and diverse needs of key populations.
Our approach, we've got a hybrid approach where we've got drop-in centers as well as outreach teams, where we've got mobile clinics that is led by the nurse, and then there's drivers, counselors, as well as the peer sex workers. We are hiring sex workers who are working as sex workers or who used to work as sex workers, and then we train them, empowering the information on health education, STI, HIV, as well as just general health services.
To ensure that no one is left behind, implementing partners take services to key population communities so that they can access what they need when they need it without fear of stigma and discrimination. It is important for the implementers to know where to reach key populations and leverage key population networks. Therefore, various strategies are employed to support this, including hotspot mapping, social networking strategies, and index testing.
This is the map for the district. It is used for hotspot mapping. So these dots that you see, they represent the various hotspots. This is where the sex workers are. So peer educators, they play a very important role in our program. They drive our program. They lead the mapping process. They are the one who identify these sites.
Sex workers themselves, they started doing things like your basic outreaches and activities that were sex workers led. That on its own, it has kind of like even make sure that, gatekeepers within outreaches, like for example, it was difficult for, I'll just say, health to maybe access maybe a brothel. But sex workers themselves, they form a connection to make sure that even brothel owners, pimps are able to be part of the bigger picture in making sure that we are ending HIV in 2030.
The second outreach strategy is social networking. A social network strategy is a valuable approach in engaging and motivating peers, friends, and partners to test if they are at risk of HIV.
The most important components of the social networking strategies is first identifying the seed. The seed are the ones that are introducing us to the communities and actually inviting or recruiting their friends. By taking, with the outreach team, by taking the services into the community and practicing the SNS strategy, it is then trying to close that gap.
The third strategy that implementers use to ensure that no one is left behind is index testing.
We have targeted testing services such as index testing, where we test previously untested sex workers, as well as their surrounding communities, which include their non-paying clients, their intimate partners, paying clients, and children. To implement index testing, there are minimum standards that you have to strictly adhere to. This includes maintaining confidentiality of our service users. We cannot disclose the identity, the HIV status, or at times that they are sex workers. And also another important minimum standard requirement that we have to adhere to is monitoring of adverse events. We have to again ensure, just because of participation in index testing, that our service users has not come to any harm.
To effectively implement a comprehensive key populations program to key populations where they need it also requires a dynamic and multidisciplinary team. From the driver who supports sex workers with hotspot mapping and provides security in addition to driving, to the nurse who provides a safe and stigma-free environment in addition to providing comprehensive healthcare services and linkages to other social and structural interventions. Everyone has a clear and specific role to play. Sensitized nurses play not only a healthcare role, but can be true enablers to key populations accessing the health services that they need. Services rest on the importance of developing trust and becoming more than a clinic. Driving demand and retaining key populations in programs is another critical component of a successful national program, and this has demanded flexibility and innovation. A social media strategy has been effectively used in the MSM Men Who Have Sex with Men program as a way to share information, recruit MSM, and build a network. A rewards program approach has been used with sex workers in the Bereka Girl program.
Bereka Girl campaign works. It's a campaign that provides incentives for our ladies at different intervals. So we have airtime that is given in terms of code. So we have our service users who always test but refuse to take PrEP. So for those who refuse to take PrEP, we issue them with a quiz code. This is a quiz code card. When we issue a quiz code card, we give you access to 10 rands airtime, and this airtime will also be loaded in your cell phone, and that way you get healthy messages and reminders and education about PrEP.
CDC South Africa, with PEPFAR support, has been investing heavily in programs for sex workers and for gay and other men who have sex with men. We have since 2012 developed and implemented high-quality HIV, TB, and STI services tailored to key populations. These are important because we know that even in the generalized epidemics that we live and work in, that there are sub-epidemics among key populations. These populations face higher rates of incident disease, higher rates of HIV, of STIs, and at the same time, when they go to seek services, they are especially vulnerable because those services may not be tailored to their specific needs or friendly to their populations as they come in.
Using peers in program positions and strategies underlies a fundamental principle of successful and trusted key population programs and helps to build accountability within program services delivery. Sex worker ambassadors, as an example, are another way in which demand and retention is supported, and sex workers are meaningfully engaged in the program.
The importance of peer programs that are outlined in the country. What I like about them, one thing that I like about them, they are also sex workers-led programs, and that make it easy for the peers to execute the work that is being done through outreach.
Sex workers are elected by their local cluster to be their ambassador. The ambassador then advocates for comprehensive services and holds stakeholders to account. They also support sex workers to access services and help programs to be responsive to their needs. The South African National AIDS Council, SANEC, leads the national key population HIV response in the country.
SANEC has always recognized the need of key population programs. Ongoing multi-sectoral engagements help us drive a holistic response and to strengthen strategic information as per the United Nations 3-1's principle.
SANEC sets the strategic vision for key population programs and coordinates donors, government and civil society around this complex and multi-sectoral response.
Collaborations are thus critical since all response efforts require multi-sectoral commitments to ensure that all health service delivery points in South Africa are key populations friendly.
On the ground, the National Department of Health works closely with PEPFAR and the Global Fund implementers to deliver programs in all 9 provinces.
It would have been impossible to work, just as the department without our support that we get from the funders. And we have support partners that support our 4 districts. So what we do as the department, we provide the drugs, your treatment drugs, and the prevention, the partners mostly provide us. But if there is a shortage, then we come on board.
In South Africa, we wanted to ensure no one is left behind. So we implement an integrated approach, focusing on not just biomedical, but also behavioral, social, and structural interventions. Also, we advocate for a focus on people, for people, and by people. This means we use an integrated strategies, which is a peer outreach and community mobilization. We're doing a lot to try and reduce the stigma and discrimination and call for decriminalization, which all big barriers to access. Our national response needs to remain true to our slogan of nothing about us without us. And we continue to build a solidarity amongst population groups. We demand our voices to be heard and advocate for equal access to services which are available, accessible, and stigma-free. We have a lot to share and showcase in the key population program, but we must not never be complacent.
Providing tailor-made services to our key populations and taking the services to them has been key to ensuring that our programs are impactful. Reach out to the South-South Learning Network if you would like to learn more about anything you've seen on this virtual tour, or if you would like to be put in touch with any of the people you have met in this video.